Welcome to part two of Senior Moment with Nurse Linda. Today we're talking about breast cancer. And this is Dr. Campbell behind the camera. This is Nurse Linda with all the important stuff. So go to it.
Okay, we're going to be continuing our discussion on breast cancer, and we're going to talk about screening and diagnostic work, things if a lump is found, what your doctor may want to do. The most important part of screening is the monthly breast exam, which we're going to go into more next week. But the other piece of it is having a mammogram done on a regular basis, not just you doing your self-breast exam, having a doctor do your breast exam, and a mammogram. Mammograms are done at different intervals depending on your age and your family history. A mammogram is a special type of low-level X-ray that can see into the breast tissue. The breast tissue is very different from other parts of the body. And yes, you can have a mammogram done if you are a man. It does work.
Yeah, but you have to have a breast big enough to get between those two.
They manage it, trust me.
Do they really?
They do. You don't have a lot of breast tissue, so it can be done. Sometimes they do other things, and we're going to talk about that as well. Between the ages of 50 and 74, screening should be done every 2 years. Again, this is based on you and your doctor determining what's important for you. Between the ages of 40 and 49, talk to your doctor about your family history, your potential risk based on many of the things we listed last week. And people can go back and look at that as to what your risks are, how you can decrease your risk, or what you're doing to increase your risk. Family history, etc. A lump can be found by mammogram up to 3 years before it can be felt with a self-breast exam.
Say that again.
A mammogram can find a lump in the breast up to 3 years before it can actually be palpated, before it can be felt.
It's worthwhile to take the test.
Yes, absolutely. Just because you're not feeling a lump doesn't mean you're free and clear. The mammogram is a very important piece of it. Most insurances cover the cost. If not, I have some phone numbers for people, so grab up a pen or a pencil. Many hospitals offer free screening mammograms, and they do that periodically, and a lot of them, of course, do it in the month of October, since this is Breast Cancer Awareness Month. But phone numbers you can call, an 800 number would be 800-227-2345. You can also call locally here in South Carolina, 803-545-4145. There's also a website. You can dial up cdc.gov, and they can help you find programs for free mammograms in your area where you live. So there is no reason not to get it. That's the important piece of this. Now, and please keep in mind, these are for screening mammograms.
What's the difference?
There is a difference in a screening mammogram is going to take a large group of people and just look for abnormalities. If they find an abnormality, and this is where we're going to get into the diagnostic part, they'll do a second one to try to focus in on that area of abnormality. So they do something, it's really not a lot different other than taking a much closer look at it. If anybody needs any other information, they can always call us. We have all kinds of phone numbers and things. If a lump is found, you have the diagnostic mammogram. That will give the doctors a little bit more information about what it is they're looking at. Does it look solid? Does it look liquid? Does it look just gushy? That's the way they can describe those sometimes. They're just mushy. They're not solid. They're not liquid. They're a little bit of both. Then the other things the doctor may order for you is an ultrasound. And an ultrasound is a high-frequency sound wave. It's like a sonar, just like they use on a submarine, like dolphins use. So it's harmless. And it's often used along with the mammography. And this will further help to define exactly what this mass may be. Whether sometimes they can tell it's benign just from doing these tests and nothing more is needed. But they'll look again, is it solid? Is it liquid? What is this tissue that they're looking at? Then there's something called a scintigraphy.
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 Yes, and a scintigraphy is a breast scan. It's a specialized radiology procedure, and it's usually only used when the other exams are inconclusive. It's not used on a regular basis. It's not used for screening. And it's a type of nuclear radiology procedure, and they don't use it on a regular basis because it does involve the injection of a nuclear substance, which is the same thing they do with the MRIs and things like that. So you just try to stay away from those things if you can help it. Depending on what they find with these screenings, these type of diagnostic procedures, then they go into other things. If the lump is determined to be liquid, they might do something called an FNA, or a fine needle aspirate. They take a very thin needle, put it through the breast tissue, and withdraw some of the fluid so they can examine it more closely under the microscope and determine if it's benign or malignant.
That sounds painful.
It's really not. I'm not going to say it's not comfortable, but they do numb the area and they make it as painless as possible. Then you have something called a core needle biopsy, which is a slightly larger needle, but this would be used for a lump that's solid. And they go in, same thing. They go in through the breast tissue and remove a piece of the mass and take that out for further diagnostic workup under the microscope. Now, given all of that, in lieu of those two things, or in addition to, then they may do what's called a surgical biopsy, where they actually cut the skin, do a minor surgical procedure, and remove this mass to determine what it is. So whatever your doctor thinks might be the best approach is what they're going to recommend. But those are the three possibilities. One of the other things they may do is called a stereotactic biopsy. And this is where we go back to the princess and the pea thinking. That lump may be buried deep in the breast tissue, and they know approximately where it is, but not exactly. And instead of just sticking a needle in and aiming, just hoping you're going to hit it, they do a special type of procedure under radiology guidance, where they actually locate the mass with other surgical instruments, with needles, and then they can go in directly and do whatever biopsy procedure they need to do. It is uncomfortable. It does take a while. It's not a quick procedure, but it is very helpful, and it prevents you from having to have a surgery done. The other type of procedure may be called a mammotome, and this has been used since roughly 1999. And what they do is it's a vacuum-assisted biopsy device.
Oh.
They vacuum the tissue and pull the mass into this device and then cut it from there. So now the mass is enclosed in this device. So it's something a little bit new for me, and I was doing some reading on it so I could be a little more familiar with it. And then you have another thing called an ultrasound-guided biopsy, which the doctor does the biopsy while he's doing an ultrasound. And again, it's just to hit the right spot. Some of these may include the removal of lymph nodes or not. But these are all important procedures to understand, and that they are very necessary in getting a proper diagnosis so you can get the proper treatment.
Works for me. What's our third part?
We're going to talk about things coming up and we've got a little announcement about a freebie for breast cancer survivors.
Oh, cool.
Yes.
Cool. You're listening to Senior Mo with Nurse Linda. This is part 2 on breast cancer, and we'll be back with part 3 in just a minute.